I've been on this podium before in this room. I can't begin to tell you how fortunate all of you are to be in this community and to have such a tremendous organization as Washington Hospital Healthcare System. I travel the country. I was in Tennessee yesterday. I'm going to be in New Orleans later next week, then New York, then Miami. I can't even keep track of where I am or who I am or what I'm doing sometimes, but I'm constantly talking about these things because I'm a man on a mission. And I'm very passionate about getting people the very best health care and the very best health they can, because when your health is challenged, you really can't become as fulfilled. You cannot fulfill that expectation you have for yourself. And it's rare. I can't think of another instance where there's a healthcare institution that is as committed to the community as this organization is to you. And that's why I'm here today, because I think this relationship between the providers of care and you as representatives of your families, your communities, and those who you love, and yourselves are working so hard to bond together. Because whatever they're doing in Washington, it's not going to be as important as what you can do together with your healthcare providers. And as Tracy said, I've dedicated my life to doing this, to figuring out how to get people the best healthcare by talking to physicians, nurses, pharmaceutical companies, philanthropies, policymakers, patients, and others to get all this whole thing to work a whole lot better than it has. I've written a book, I give speeches, I've got a podcast, I write op-eds. This is my mission, this is who I am. So it's particularly a joy to be here. And we've talked a bit about the mission of the Washington Hospital Healthcare Organization, but it is so community-centric. The people that are responsible for the administration of this institution go into the community. They understand the heterogeneity and the diversity and the strength of this community. They know the things that need to happen to improve the health, not only the health care, but the health and the well-being of the community, so that everyone, women, men, children, older people, younger people, immigrants, people who are unemployed, people being subjected to adversity, can have the very best medical care and have the greatest potential to become as fulfilled as they are. And as I said, I'm a very active person today. I had an opportunity some years ago to potentially retire, and I spent 6 months thinking about that, and I said it's either one way or the other, either kind of dial it down or dial it up. I said, I love what I do. I'm just going to dial it up, and I've never been happier. I'm working harder than I ever have, and I've never been happier because I'm doing something that I think is really important. And it starts right here. You know, we've all been on airplanes, right? And it always strikes me as just so unusual that one of the things that happens when you're on an airplane is the flight attendant tells you, you've been there, if the oxygen mask drops down and you've got a child with you, the first thing you do is you put the mask on yourself and then you take care of your child. And that has always struck me as so contrary to every parental instinct, right? All of us have families. Those of us that are blessed to have children, our instinct is, I would do anything. I would jump in front of a car, right? For my family members, there's no question in my mind that I would do that. But the notion of putting that oxygen mask on first so that you can take care of your child or your loved one, to me makes so much sense, particularly when it's applied to healthcare. You as women, still circa 2017, as our world continues to evolve, in most families today, women have principal responsibility, certainly for their own wellness, which includes health care, diet, exercise, awareness, balance, stress reduction, all of that. But they generally are the people most responsible in the family for the health care of the family. Whether it's taking care of yourself and your spouse, if you have one, children, elderly parents, or the people in the neighborhood who look to you to help out when somebody's got a challenge. So you are very influential, pivotal in making sure that you take the very best care of yourselves, because when a woman is sick, it affects the family disproportionately to anyone else, but also for trying to encourage everybody else in the family to be as well, as healthy, and as fulfilled as they can be. And it's a very, very important role. So what I want to do is take some time to tell you things that you can do beginning this afternoon when you get home, and that everybody can do, that can make an enormous difference. But to do that, let me start with the bad news. The bad news is we lose about 2.5 million people a year in the United States. So the goal here is you don't want to be one of those, right? It's like when they say to, what do you want them to say at your funeral? He's still moving. But we got to start with some of the bad news, which is the things that we need to prevent. And if you see here, the causes of death in the United States of America are far more concentrated than most people appreciate. Fully 50% of everyone that we know, unless things change dramatically, is going to succumb to either cancer or heart disease. Cancer or heart disease. And that's a bad news story, but the good news part of it is the heart disease part are largely preventable with changes in lifestyle and diet and exercise and monitoring. And the death rate from cancer, some cancers are certainly preventable. Smoking, exposure to the sun, asbestos, and other things. And other cancers are curable if they're caught early. So things like mammography, colonoscopy, going to dermatologists to detect cancer early, having a strong relationship with a primary care physician, doing things that we can talk about in a couple of minutes can dramatically reduce your risk of dying from either one of those conditions. And as Dr. Dow said early on, it is never too late to adjust what you're doing. The data show very conclusively, at whatever age, at whatever condition you're in, it is not too late to make a significant difference by making even subtle adjustments in what you eat, in how you exercise, and other things. So those are the first two leading causes of death, and we're going to focus on those. But let me tell you what the third is. You know, kind of everybody knew what I've said so far. It's not new news to anyone. The next slide will be. The third leading cause of death in the United States of America is preventable medical error. You've probably never heard that before, but you're all people that have friends, you talk on the phone, you have relationships, you've heard of stories. Dr. Smith missed this in Mary. George had this problem and it went bad and it shouldn't have. You've heard those stories, but if you look at the medical literature, it shows between 200,000 and 400,000 people, U.S. people, every single year die from preventable medical errors. And that doesn't include the unavoidable consequences of a medically necessary intervention properly done. These are just frank mistakes, missed diagnoses, botched surgeries, physicians who shouldn't be doing something of the complication and sophistication that they've undertaken to do. So my goal today is to give you concrete, practical steps that absolutely everyone can do to minimize as much as humanly possible the likelihood that you're going to become one of these statistics or that you're going to die prematurely from the major killers in the United States. And you sit there and say, well, can you really do that? Actually, you can. There are things that you can do, and I want to dig right into it because it involves taking charge of your health. You know, healthcare is about 18% of our economy. It is the largest sector of the entire economy, and we Americans are fabulous consumers across the entire rest of the economy. When it comes to getting a better cell phone plan or renting a car or finding a deal on a vacation hotel, getting the best airfare, you know, renting the right apartment, doing all that stuff, we are great consumers. We've all learned how to get online, get ratings on things, go to Amazon, get discounts, go to Costco. We do all of that stuff, and we are terrific at doing it, with the exception of what I would submit to you is the most important service that our society provides to people, which is healthcare. For reasons that I really don't understand when it comes to healthcare, we tend to be extremely passive. Our consumer DNA tends to be suppressed, and that's a mistake. What you need to do, and I say that with a point, what you need to do to minimize the chance of your becoming one of those statistics, to extend your life, to be as well as you can, to get that opportunity to fulfill those dreams that I know are bubbling up inside of each of us, you need to take charge of your health. Now that's a broad statement, and what does it mean? Well, there are 4 steps, and I just want to go through them pretty quickly because they're very important and everybody can do them. The first is have a strong and enduring relationship with a primary care physician. Who has that in the room today? Somebody you really, really like? Most of you do, and some of you don't. But I'll bet for each of you who does have that relationship, there's somebody in your family who doesn't. It might be a millennial who's on his or her phone all the time, Facebooking and Twittering and Snapchatting and Instagramming and all this stuff, who goes to an urgent care clinic rather than has a relationship with a physician. It might be your husband who says, I don't want to go to those doctors, I don't want to hear what they have to tell me. I'm perfectly happy with what I'm doing. You've been there. So let me give you a very straightforward 4-step process to find for yourself or a loved one a primary care physician. It is so straightforward and intuitive. You're going to say, well, of course, doesn't everybody do that? But I'll tell you, nobody does. Step 1, take out a piece of paper, or if you're younger than I am, put your fingers on a keyboard, because you don't use pens and paper anymore. I don't understand. But take out a pen and a piece of paper and write down the things you're looking for in a primary care physician. They need to be in-network in your insurance carrier. They need to be not terribly far from where you live or where you work. Maybe they need to speak your primary language or the primary language of a relative whose English is not very good. You want them to be compassionate. You want them to be supporting of your achievement of your healthcare goals. Whatever it might be that's important to you, take out a piece of paper, and every time something pops into your head, come back to that piece of paper over a couple of days and put it down. You'll get a list of 10 or 15 things. We all do that. Second step, talk to friends, neighbors, coworkers, people you know in your religious groups, whatever it is that you do. Think back to all of those discussions you've had with people. Who has said that they really like their doctor? There'll be a discussion you had, maybe at a lunch one day, driving to a ball game or watching kids or doing something with somebody. You know, I just had a really great experience. Think about all of the people that you can contact and ask them, does anybody have a good, whether it's an OBGYN or an internist or whatever it might be, or a pediatrician. You remember when we had kids, everybody would interview pediatricians, and that was a really big, important part of getting ready to have a family. Well, it's even more important if you're older. So think about that. The next thing that you can do in step 2 is if you have any physician who you like, maybe it's an OBGYN, a dermatologist, a urologist, whoever it is. You know, doctors have doctors too. And if you have a doctor who you like, call him or her up, right? It works all the time. And say, who do you use? It's extraordinary how often that's a person who's going to work for you. And it's even more extraordinary to me how infrequently people use that technique. It's almost a one-to-one fit. And they will all tell you who they use. The way, I run a business where we get retained by people from around the world to get them the best medical care. How do we find the best cardiologists? We call 15 cardiologists in town and say, if you had a cardiovascular problem, who would you use? Who does your wife use for her OBGYN? You ask the OBGYNs who they use when they get pregnant. Oh my God, it gets really clear. They know. And it's unbelievable the information that you can get. So step 1 is to write down what you're looking for. Step 2 is to put together a large group of potential people who would be potentially of interest to you because of all of these things. Step 3, go online and do some homework. Make sure that they're board certified. Board certification is extremely important because it is indicative of somebody who is committed to their craft and really wants to be the best at it and to be very current in doing it. Also, make sure that they don't have any certifications, they don't have any sanctions against them by the regulatory authorities. You really don't want to be with people who've had all kinds of problems with the regulators, because where there's smoke, there's typically fire, right? And we all know that. So spend a little time doing that. And then step 4 is one that very few people do, but before they listen to me, but when you do it, it changes everything. Pick 3 to 4 of the docs who meet your qualifications, who you've got good references on, who are board certified and don't have sanctions. Call up their office and say you want to interview the physician. I know that sounds crazy, right? You want to interview the physician. Most doctors will do that today. Look, we've all worked. Anybody who's worked, you've been on the other side of the interview table, and you know how important it is to make sure that there's a meshing. And anybody that's hired someone has interviewed them, whether it's for a babysitter, a nanny, whatever it might be, a caregiver for an elderly parent or a friend, whoever it is, you want to spend time seeing if there's chemistry. Chemistry really matters in the primary care setting. Not so important in surgery, because when the surgeon's doing their work, you're going to be out of it. But in the primary care setting, it better not be that way, right? This is somebody who is arguably the most important professional in your life. Many of you, I suspect, my wife does, have enduring relationships with your hairdresser. I mean, my wife has been with her hairdresser almost as long as she's been with me, and there were days and weeks where she's got a better relationship. I shouldn't go there. I didn't mean to say that. But I can assure you that your primary care physician is the most important professional relationship in your life. Call up the office and say, look, I'm looking for an enduring relationship with a primary care physician. I'd like to come in and spend 10 or 15 minutes, meet Dr. Jones. He was referred to me, she was referred to me by my friend so-and-so, just to get a sense of how he or she practices medicine, to make sure she understands who I am, and see if there's a fit. And I am telling you, one of the benefits, the things that's changed in the healthcare system is physicians are now understanding the importance of doing that. And when you do that, you see, not only will you have the opportunity to evaluate who that physician is and learn about their practice, make sure you interview 3 different docs. No matter what you think about the first one, do at least 3, whether you want to or not, because I want you to make an informed choice. And when you have made that informed choice, that changes from your vantage point the nature of that relationship, and it for all time will change how that physician will look at you. They will see you as who you are, an empowered patient who is passionate about her well-being and is going to be engaged with the physician in getting the very best. So that's step 1. Take full advantage of primary care, because it's the primary care physician who's going to make sure that you get the benefit of all the wonderful prevention and early detection technologies we have today. It's going to be the person who's there if you have something really weird that's happening to you, who will know who you are, will have taken care of you hopefully for months and years, will say, this kind of pain feels very different than what I've heard from you before. I think we have to act differently on it. That kind of connection is invaluable. So that's the first thing you can do for yourself and your loved ones. The second is collect your medical records. We all have records stored in all kinds of ways for taxes and insurance policies and all kinds of stuff. But because of the craziness of the healthcare system and some of the deficiencies, very, very few people have all of their relevant medical records organized in a binder. It's really, really important to do that. Those of you who are getting care here at Washington Hospital Healthcare System, you can get access to my chart, which is the electronic medical record that they've spent a lot of time and a lot of money putting in place, and it's terrific. But if you have care outside of this system, you aren't involved in it, go to your physicians, get a HIPAA release, which you can get online. It's very easy to get, or ask the office to give it to you. Just sign it. Those medical records are your property every bit as much as a car is when you drop it off at a valet parking. They're your property every bit as much as your clothing are when you bring it to the dry cleaner. That's your clothes. It's not their clothes. Those records are your property. Every physician in the country understands that legally, and they are obligated to give you your medical records. So what I do, and most everyone that I coach does, is they just get a 4-inch binder, whatever it might be. They take the 10 or 12 doctors, 8 doctors, whatever the number might be, spend a little time on the telephone, faxing in a HIPAA form, just dropping it off. Doesn't need to be done today, it just needs to be started. And then collect all the medical records, stack them up in a binder, so that when you go to an additional physician, they can have the benefit of your medical history. A lot of those 400,000 deaths that happen in the United States due to preventable medical error, those errors occur because doctors don't have the benefit of the medical history that I just described to you. Give you a personal example. We had a patient who had very significant digestive issues. all kinds of stuff going on for 8 years. A relatively young guy, he's about 34 years old. And he had had to drop out of the workforce, was on disability, had no social life, was spending most of his day at home in gut-wrenching pain, increasingly over an 8-year period. Took away all of his 20s and the beginning half of his 30s. Precious times in life where you shouldn't be in bed at home and sick. You should be out and doing and growing and creating relationships and trying to figure out who you are. And the doctors couldn't figure it out. We got involved. The first thing we did is collected all of his medical records and interviewed him to find out everything that had happened before these episodes and during them. And it turned out that he had been on a backpacking trip through a bunch of countries in Asia about 2 to 3 months before this problem really kicked into gear. And he simply had neglected to tell the doctors about that. Well, it turned out we did some research, and one of the countries he had gone to had a very diabolical parasite. And we theorized that he picked up that parasite because his symptoms were reflective of that kind of parasitic infection. And what happened was he continued to have that parasitic infection for 8 full years. Nobody knew the history to figure that out. It took us about 4 to 6 months to rid that parasite from his body, to get his digestive system functioning again, and he's now back to full life, all right? It's a complete recovery because there was one critical fact that none of the doctors knew. And that's the sort of thing that happens all of the time, all of the time. Physicians are the only respected professionals in our society for whom they provide service and provide judgment with incomplete information. Your tax accountant's not going to do your taxes unless you give them everything, all right? An auditing company is not going to audit the corporate books unless they have everything. A lawyer is not going to represent you if you have a problem, if they have a sense that you're not telling them everything. You need to give professionals all the information that's relevant so that they can be on the top of their game. And what you can do in order to make sure that you don't fall prey to those problems is collect your medical records, put them in a notebook, digitize them, and if you can, create a summary, because if you do, I promise you, the quality of care that you get will be dramatically improved. The third thing is write down your family health history. We all have elderly relatives. You know, we don't know how long they're going to continue to be with us. I just lost my wonderful Aunt Edith at 96 last year. And my Aunt Edith, she had a lot of physical disabilities for her last 10 years, but my God, she didn't lose 1% of her memory. She could still remember, you know, the brisket recipe that she started making when she was 22 years old. She could remember my bar mitzvah. She remembered the dates of all 12 of her grandchildren's birthdays and the names of their teachers. Her brain was totally intact. And when she became a little more frail, we actually tape recorded the family history from her, and my God, she remembered everything about everybody, and that has now become an invaluable resource for the entire family. Because we know that as a family, we have a common heritage, we have common customs and traditions. That's what defines us as a family, and values and beliefs. But we also share common DNA. And as we're learning, and a lot of that work is being done here in the Bay Area, the DNA that we share is quite determinative and influential in figuring out what our health risks are, what drugs we're going to respond to, and what kind of protection and monitoring each of us should get. And that runs across the family. So if you can collect the family health history and write it down and give it to everybody in the family, you're doing them an enormous service in ways that you can't even begin to imagine now. It is a wonderful gift to give to all of your relatives. I'll tell you a very personal story on this. When my wife was in 2nd grade, she had, and this goes back many years, I'm not going to tell you how many, she had anemia. And she basically missed all of 2nd grade or most of it, because of that. And they frankly didn't think that she was going to make it. This was in the dark ages. They didn't think she was going to make it, and it was a really scary time for her, and it's been a very defining experience, and has frankly made her a very strong person because she powered through that. And she had her spleen removed, and when she had her spleen removed, miraculously the anemia resolved, and she's never had a problem since. She's got a little scar, but that's it, and she's otherwise fully healthy. So everything went forward, and about 6 or 7 years ago, our second daughter was donating blood for a Red Cross blood drive at college, and she called me up in a total panic because she had gotten a letter from the Red Cross that said that they rejected her blood because they thought that she had some sort of terrible disease. And I thought, oh my God, here's my precious daughter in college. The Red Cross rejected my daughter's blood, and they thought that she was a drug addict or something. She's never had more than an aspirin in her tongue. She's the cleanest, most earnest, child you could ever imagine. And I thought, oh my God, this is going to be a leukemia, this is going to be a lymphoma, this is going to be some sort of hematologic disaster. Didn't know what to do. The local hematologists where she was at school couldn't figure it out. So she came home a week later. This is my business. I brought her to the very top hematologist in Los Angeles. There was this little thing that was spinning in the back of my mind. I was hearing the echo of my wife's sort of second grade anemia, and there was some attributes of it. So we went to see this really brilliant hematologist, and my daughter is scared as could be. I was frankly scared as could be. And I started to explain to him her situation. He's nodding his head. And I said, there's some other little fact here that you might want to know. I told the story of my wife, and it was like a bolt of lightning in the room. He said, well, I got a little more testing to do, but I think you just not only diagnosed your daughter's condition, but you diagnosed your wife's condition from 40 years ago. And it turned out that my wife had a hereditary blood disorder that slightly adjusted the shape of her red blood cells, which meant that they were not as healthy as regular people's, and that my daughter had finally inherited that disorder, and it had a slight problem for her. The story is, all she had to do was be on some iron pills, and that was the cure for the whole thing. And my recollection of that one clinical fact enabled him in minutes to diagnose something that doctors in another part of the country who didn't know that fact had been unable to diagnose it. So those kinds of family medical histories are really, really important because they can help people figure out what their risks are, what their exposures are, and enable them and their physicians to do a much better job. And it's not that hard to do, and it actually becomes extremely interesting for everybody. The next thing to do is healthcare issues don't happen by appointment, right? Emergencies happen at the most inopportune times. About 3 weeks ago, I'd just gotten home from work, was upstairs changing my clothes, ready to, changing from being a CEO to being a husband, right? I have to make that transition. And my cell phone rings, and it's a friend of mine reporting to me that a very dear friend of ours had just had a very serious coronary issue in Utah. And he was calling me from the car. He was on the way to the airport, and this was a potentially fatal condition. And we harnessed about 10 or 15 people to figure this thing out. And the problem that we had at the outset is we didn't have the critical information we needed to facilitate getting him the emergency care he needed. We got through it all, but it was like 10 times more difficult because he didn't have this. He didn't have an emergency medical card. Each and every person should have an emergency medical card. Look, today, is there anybody that leaves the house without keys? No. Is there anybody that leaves the house without a wallet? No. Is there anybody who leaves the house without cash in their pocket, a credit card, and a cell phone? I don't think so, right? And why is that? Because it's not safe, right? Because you don't know what's going to happen. You want to have 20 bucks in your pocket. You want to have a credit card. You need your cell phone to communicate with people, and you need your keys, right? That's basic stuff. I would submit to you that your wallet is not complete unless you have this card in it, and unless everyone in your family has the same thing. It is so important because you just don't know when it's going to be needed. Yeah, it'll take 20 minutes to put together. Not the end of the world. You put it together once, and you'll have it with you for a very, very long time. So it has your name, it has contact information, it has insurance information, it states what your allergies are, what the medications you are, and what your diagnoses are. So if the God forbid happens, if you fall down the steps, if you choke on something, if you bang your head, if you just sort of get up too quickly and your blood pressure doesn't adjust and you faint, all of us have had those things happen. We know people have had those things happen. The EMTs need this information in order to make sure that they don't make mistakes. So don't just think of them as being magicians. They're doing God's work, but they're not magicians. Give them the information they need to keep you safe, to keep you well, to exercise their judgment, and to do the best job they can. And if it turns out that you're alone and you're unconscious, the EMTs are really high trained, and they are amazing people, I have to tell you. They'll get you stabilized, and then they're going to scramble to find out who you are. So they're going to go to that wallet, whether it's in your pocket if you're a guy, or in your purse if you're a woman, and they're going to find out who you are, and they're going to know who to call. So just about everybody in my life has one of these cards. Everyone in my extended family, which is probably 40 or 50 people when you get to second cousins, and you get out there, everybody's got one. Everybody in my office, every patient we take care of. And I have to tell you, I hope no one ever needs it, but people generally do at one point in time, and it makes an enormous difference. So that's 4 things. They're all very straightforward. Now, does this make sense, right? In any other world, it's the kinds of things that you would do, but for reasons that I don't understand, people don't natively do it in healthcare. And I'm asking you to do it because you're women and you're the leaders generally in your family of what needs to happen medically. Now, even if you do all of that, major problems can happen, right? I mean, none of us gets out of this alive. So we do get sick. You know, I've had 3 surgeries myself. Stuff happens, particularly as you get older. So I want to teach you now getting to the no mistake zone. It's a similar, straightforward process that each and every one of you can use, but let me walk you through it. I've been doing this for years. It took me 15 years, literally, to tune this up and boil it down so that everybody can do it. And we have done this across the board in medicine, everything from fertility issues to complications of childbirth to early childhood development to behavioral disorders in adolescence to cancer and heart disease and autoimmune conditions and diabetes and end-of-life issues. We have used this across the entire spectrum of medicine, and it is just a straightforward process that can reduce anxiety, improve control, and make sure that you're getting the very best medical care. So let me go through it, okay? And then we can talk about it. So in most issues, except for trauma and a heart attack and those kinds of things, there's usually time to think. And I believe that that's a precious time. So the way to start the process really is to stop. Sounds a little counterintuitive, but if it's something that doesn't require, if there isn't blood gushing and broken bones, palpitations and those sorts of things, there's time to stop the train from moving too fast for you to get control of it. So the first thing to do is really to stop. The second thing to do is to stay balanced. I was never a great athlete, but I learned from all the coaches. I never got sort of beyond this. The best way to start virtually any athletic undertaking is kind of like this, in a neutral position, right? Your legs under your shoulder, your weight balanced left and right, just everything in balance. And that's the image, right? That's the image to start a healthcare situation. Don't think, well, we got to have surgery. This is something that needs to be treated now. It's radiation. There's really nothing to be done. Just stay in neutral. Be open. Because if you're open and you're in balance, all of the input that you get will be naturally organizing itself. You'll be able to follow the process that I'm going to describe to you. We've been taking care of a woman in Boston who's just this incredible dynamo, who has a meningioma, which is a growth in her brain that's not cancerous, but is gradually growing, very gradually growing. And it's a really, really tough problem because she doesn't have any symptoms. It just shows up on imaging. And if any intervention with it runs the risk of having some side effects because of where it is in her brain. So she has this diabolically difficult balance of, do I let it be and maybe it's going to grow a little bit? Or do we risk taking it out right now and having the side effects based on it? And it's one of the hardest problems I've dealt with in the healthcare system. And I will tell you, I've had a lot. And she was driving herself crazy. I've gotten very close with her over the years. She was driving herself crazy because she was going to a lot of physicians. And with each physician, she would say, that's what I want to do. And Dr. Smith said he wants to do surgery, and here's the route he's going to take, and that's what we're going to do. And then she goes to see Dr. Jones, and Dr. Jones says, well, actually, I've got this minimally invasive approach where we can come in through here and do that. And then she goes to Dr. Kanziokla, and Dr. Kanziokla is an expert in stereotactic radiation, and he's got an approach to it. And then she goes to another doctor and says, you don't need to do anything. And she was driving herself crazy. So I said to her, here's what we're going to do. I need you to just stand up. We were on the telephone. She said, what? I said, stand up. Humor me. It's okay. She said, all right. I said, here's what I need you to do. Just stand straight. I need you in balance. Here's what we're going to do. There's 5 additional physicians that we're going to talk to, and I don't want you to think about what you're going to do at all until we finish getting all that input. We're going to do some research in the medical literature, but I don't want you to think about a decision until we get all of the information, because when we do, the path will reveal itself. That's the magic about this. Everybody with a tough medical issue wants to get it behind them, right? I need this behind me now, but sometimes the fastest way to make that happen, you know the old phrase, sometimes the longest way around is the shortest way home. Sometimes the fastest way to get it behind you is to just stay in balance, go through a disciplined process, and I will tell you, it's kind of magical. The path will reveal itself. So what's the path? How do you get there? It's 6 steps. The first is, make sure that the diagnosis is specific and confirmed. You just don't want to hear that you've got back pain. There's so many different kinds of back pain in different parts of the back that come and go in different ways. Some are caused by muscular issues. Some are caused by ligaments. Some are caused by discs. Some are caused by autoimmune conditions. Some are caused by structural issues. There's so many different causes for back pain that the diagnosis of back pain is like, I'm feeling crappy. You can't treat I'm feeling crappy. You need to know specifically what it is that's wrong with you. You know, there are people in the room who've been touched by breast cancer. There are too many people here not to have that. And I don't want to ask people to raise hands. But there are many, many different kinds of breast cancer. What you need to know is specifically what is the nature of your breast cancer, and then specifically find providers who are expert in that type of breast cancer. So the first thing is make sure that the diagnosis is specific and confirmed. For our cancer patients, 100% of the time, we have the biopsy tissue reread independently by another pathologist. It costs $150. Insurance pays for it. It's about 25 minutes or an hour of aggravating bureaucracy. Okay, I get it, but it's your life. There's nothing more important than making sure that that biopsy is accurate. And when we do this in 10 to 20% of the cases, there's a significant change based on that. Now that's scary, right? But you know, that's the level of error that occurs in the healthcare system. It shouldn't happen to you because you can make sure that it won't if you follow this. So the first thing is to make sure that the diagnosis is specific and confirmed. The second is you need to become convinced about when and why it needs to be treated. There are things like pancreatic cancer that need to be treated now. Brain cancer needs to be treated right now. Certain forms of breast cancer, we have to go, and this is the time. Comes to prostate cancer, a lot of prostate cancers, well, let's just wait. This thing may never manifest itself and become clinically significant. There are so many conditions where there's a wide gradient of when things need to be treated. And you need to engage your physicians in a dialogue, not only the expert who might be treating you, but leavening that view with the discussion with the primary care physician that you found at the beginning of the discussion, right? how quickly does this need to be treated? And why does it need to be treated? We're taking care of a woman in Chicago who fell in the shower. She had a blood pressure issue, and her blood pressure got too low, and she got in the heat of the shower, she passed out. She knocked her head. She was unconscious. She lived alone. Really scary situation. When she came to, she crawled out of the shower. She was a little dizzy. She found her cell phone, dialed 911, got taken to a community hospital. An hour later, she was being seen by a doctor who said, we need to do emergency spine surgery on you. And it's very complicated, and the chance of paralysis is very great. Oh my God. I mean, she walked into the shower. She was getting ready to go to work. She was thinking about which blouse to wear and all the meetings and all the stuff that we all do when we're getting ready. And now they're talking about maybe, she said, I don't believe it. I don't believe it. We had a relationship with her sister. Her sister brought us in. We looked into it. She did have a serious issue. It was not an issue that needed to be addressed rapidly because she was in a stable situation. The surgery they wanted to do on her was one of the most complex spine surgeries you could do. And the surgeon who they wanted to do it had been minted and gotten his MD 18 months earlier. No, I don't think so. I don't think so. It's like giving a 16-year-old who just got his driver's license the keys to an F-16. This isn't going to happen, not on our watch. And it turned out, and this is not, I mean, it's a particularly extreme case, but it's not that unusual in all kinds of ways. So we found out that the only danger she had is if she had another major fall. Well, she was in a hospital bed. She couldn't fall unless somebody dumped her out of the bed. So we identified the physician in the Chicago area with the greatest expertise in the procedure that she needed, which was a much less significant procedure. We did a hospital transfer. 3 days later, she had this procedure, was out of the hospital. 2 days later, was 100% pain-free and just fine. She could have been in a wheelchair unnecessarily had they not thought about when and why it needed to be treated. Happens all the time. Those are legitimate and essential questions for you to ask. The third piece, you're all intelligent people. You're here because you want to know more about healthcare. The third step in the process is to understand the most important things about your condition. Understand the treatment options. And you say, this is complicated stuff. Doctors train for years going to medical school, nurses train. Those are skilled clinicians. How am I ever going to figure that out? You can figure it out. I promise you. And when you do, your anxiety level will go down and the quality of care that you get will go up. Fear is the absence of knowledge. Let me say that. Fear is the absence of knowledge. When you educate yourself on whatever condition you have, no matter how complex, you will become less anxious, more capable, and you'll be able to partner with your doctors and you'll make more informed choices. Now, how do you do that? There are fabulous resources online. The internet is great for finding out the best sushi place or tacos or the cheapest tires or the airplane. I mean, all this stuff which doesn't matter. I've eaten in the 5th best sushi place. It's perfectly fine. And I've had the 15th best burger. I could care. None of that stuff matters, right? This matters. And the internet is your best friend on this. So there are tremendous resources that are in the handouts. I'll just outline a couple of things for you. For example, we Americans are remarkably philanthropic people. For every single disease I have ever heard of, and that's a lot now, with maybe a couple of small exceptions of exquisitely rare things, there is a disease-specific philanthropy. Those philanthropies are paid for by us. People make donations here, there. You've walked in breast cancer things, you've done races, you've seen car washes, you've seen all kinds of things in fundraisers. And one way or another, people have donated, whether it's $5 or $20 or millions of dollars, it doesn't matter, people donate. And those philanthropies, in my experience, 100% of the time are staffed by really caring, dedicated people. Almost every one of those philanthropies has educational material and resources to help you with a diagnosis. So whether it's breast cancer or diabetes, it's asthma, it's prostate cancer, there are foundations that are dedicated to helping you Even standing here today, there are people in offices, in buildings, sitting in front of their keyboards, waiting to answer the phone, to answer your questions and guide you through this, to send you material, objective material they've put together to help you. Give them the opportunity to do that. Most of those people have been touched by the disease. They really care about you. They have been through it. They understand the agony. They understand the anxiety. And they've got great education materials. There are other websites that are just terrific. For example, if you've been diagnosed with cancer, there's a group of 26 of the major cancer centers in the world called the NCCN, the National Cancer Cooperative Network, nccn.org. And they have come together. These are the very top centers. You've heard of them, Memorial Sloan Kettering and MD Anderson, and I think UCSF is in it, and the Cleveland Clinic, the Mayo Clinic, they all participate. And they have developed treatment guidelines for all of the major cancers. They've got them in English and Spanish for patients and physicians. They're free of charge. All you need to do is click the mouse a couple of times, hit the print button, look at it on your screen, and you'll then have the information from the most thoughtful people in the disease available to help you. But there are so many resources online. Once you dig into it, you will find them. And it doesn't matter what your educational background is, doesn't matter what your native tongue is, it doesn't matter the disease that you have. There are resources available to you that can educate you so that you can make more informed choices and partner with your physicians. And I'm telling you, what that will do is it will reduce your anxiety and it will enable your physicians to be at a better level. The next piece is to meet with a number of different experts, physicians who specialize in whatever it is that you have. You know, Washington Hospital Healthcare Center has some terrific specialists across the board here. If it's a joint replacement that you need, there are people that fly in from around the world to the center that's just across the street here. And those people are awesome, right? Meet with people at the top of the game with whatever it is that you have. And people say, oh, I'm just a regular person. You know, why is some big fancy pants doctor going to meet with me? That's what they do. They want you to call. They're caring people. And again, I deal with the very top physicians across the board, around the country and around the world. And it's really interesting to me that the higher level they are in the hierarchy in general, the more compassionate and open they are to patients who assert themselves and want advice and consultation, particularly if you can signal to them that you're doing what I'm talking about here, that you're an educated patient, you're taking control of your own health destiny, and that you're going to become an informed partner with them. So meet with a couple of docs. Don't just meet with one, okay? Life's too complicated. There's always multiple paths for every healthcare issue, and you need people that can illuminate different paths. And they're there for you. Take notes, take somebody with you. And what we're doing now more often than ever, you know, everybody's got, you know, a supercomputer in their pockets. Here's mine, right? You know, 20 years ago, this was a supercomputer, right? Everybody's got in their pockets. It also has a recording mechanism. You just hit boom, it records. Doctors today are surprisingly comfortable when you say, is it okay if I record this discussion? The reason when they become comfortable that what you say is, I record this discussion because I don't want to miss anything you've said. And I've got a husband, I've got kids, I've got a neighbor, and they really want to coach me through this. What we're finding today is virtually every physician is very, very comfortable with that, which surprises me actually. So you take out your phone, you put it on the table, you just hit the record button and boom. And by the way, it can record for hours, whatever kind of phone you have. So that's a way that you can re-listen to what the doctors have said, okay? The next piece is, as you do this, as you stop at the beginning, as you get your balance, as you confirm the specificity of the diagnosis, you understand when and why it needs to be treated, you take a couple of hours to educate yourself on the disease and the options, and you meet with different experts, what will happen is a path will begin to reveal itself. You'll shed this opportunity. You won't want that physician. You'll get a sense of what the timing should be. And I am telling you, that's the time to engage your intuition. You've all made choices over your lives. Some better, some not so good, right? Think about those decisions you made that were the best decisions, the very best decisions, and what your gut told you about it when you made those. Get in touch with that gut feeling, because that gut will engage at this point in the process. And when it does, you'll be able to see the treatment path that you want for yourself, the person you want to be the lead physician, the hospital where you want it done, and when you want it done. And when that happens, you're now officially in the no mistake zone. And when you're in the no mistake zone, what I encourage everybody to do is to proceed with courage and confidence, not anxiety and fear, because you have literally done everything that anyone can do. And you will be getting for yourself or your loved one the very, very best medical care. That's the key to doing it. I've done this thousands of times. I've trained my team to do it. I've been crisscrossing the country talking to people about it. I get emails, I get phone calls, I get beautiful notes from people about how this simple process itself has changed people's lives, particularly in their times of need. So there's one other point I want to talk about. That's sort of my favorite point in some ways, particularly for this group. The point is that smile and that look. It turns out, as everyone has said earlier in the day, there's a connection between the brain bone and the body bone. Your mindset, your orientation, your mood, your view about the future is very intimately connected to your health. It might seem that there's a disconnection, but there's not. They are far more connected than anyone would recognize. And the research is beginning to reveal this. The old notion of the mind was separate from the body and their mental health issues and physical issues, utter nonsense. When people are depressed, pain feels differently, right? We all know that the body was made to move. We should walk more. We should get up. You sit in your butt with your clicker watching the TV. It's not good for you. We all know that. But you know, if you're depressed, you can't. You don't have the energy. You can't get out of bed. On the other hand, if your leg's broken and you're in pain and you can't do those things, you're going to get depressed. If you've got a medical issue that's unresolved, you're going to get anxious. If you've got some financial stress, you're going to have anxiety. Anxiety is going to affect your cardiovascular health. Your cardiovascular health is going to deteriorate, and you're going to end up in all kinds of troubles. These things are all connected. And I want to address that important point. One of my favorite studies, and I spend most of my waking hours. My wife reads fiction. I don't like fiction. So I sit with medical journals and I read articles. And I'm not a physician, but it's what I love to do. It's weird. My favorite study of all, and I've read a lot, is this study. It's a 60-year study of 180 nuns in the School Sisters of Notre Dame. So here's what they did. Nuns are a great natural experiment because when they live in a convent, they wear the same clothes, they eat the same food, you don't have a lot of choice in the menu, they do the same thing every day, and they're all together. Some live longer, others live shorter lives. What a great place to study what the consequences might be of certain things in life to see who lives longer and who doesn't, right? So what this study did is it took nuns who were born before 1917, quite some time ago, who were in the School Sisters of Notre Dame. There were a couple of residences, convents, where they wrote biographies and kept daily diaries. So they found the diaries between 1924, I think, and 1935. Don't hold me to exactly those years. And they reviewed the diaries, de-identified by the nurses. They had people look at them to measure whether those diaries were reflective of somebody who had an optimistic view about the future or a pessimistic view about the future. Did they think things were good or things going to be worse? Was this all a catastrophe? We falling off the cliff, or we're going forward and we're going to figure it out and things are going to be fine? And we all know in our lives people who are at one end of that spectrum versus people at the other. We know when we get the phone call from somebody, it's, oh God, the car's got a nick in it and this is bad and I burned to this and everything's going to hell. with somebody else who's just going forward, right? It's all going to be fine. Come on, don't sweat the small stuff. So, and then they looked at how long the nuns lived. What do you think the results were? Exactly right. It turns out, and they were able to do this over a long period of time, for the nuns that were the most positive, about 60% of them lived into their 90s. For the ones that were least positive, only about 25% of them lived into their 90s. So the attribute of how you feel about the future, which I would submit to you is actually a reflection of where you fit in the universe, which is, I'm here. It's going to be fine. I'm here for a reason. There's a path for me. The path will evolve. There isn't a one of us that hasn't had speed bumps and potholes and fallen down, done some stupid, ridiculous things, had some awful, unnecessarily unjust things happen to us, right? But you pick yourself up, you kick yourself in the butt, and you move forward. And it turns out when you do that, you have a 2.5 times greater likelihood of living a longer life. There's been a lot of other research that's been done on this, and I'm fascinated by it. More powerful, not to diminish the importance. It's more powerful than the diet stuff that we were talking about before. It's more powerful than the exercise. It's more powerful than all the drugs that all of the pharmaceutical industry puts together. That's not to diminish the importance of monitoring your blood pressure and your cholesterol, of having high-quality medical care, but this is something that the healthcare system can't do for you. This is something only you can do for yourself. So if you have a positive attitude, if you don't sweat the ridiculously unnecessary details, you have a 56% lower incidence of heart disease. You have, a 30% reduced risk of dying from heart disease. Almost a 50% reduction in the risk from stroke, 23% reduction in the risk of rehospitalization if you're an elderly patient, and a 14% reduction in the risk of mortality just by being in touch with the positive future that's there for you, as opposed to the potholes and the other stuff. Now, I'm not quite sure how to get there, but I work on it every day. I mean, truly. When I find myself pissed off, as I was the other day, because an airplane I was going on got delayed, which meant I had a 3-hour layover in some airport when it should have been 45 minutes, I said, I'm killing myself. All right, I can be pissed off, but it's going to cost me a few years. So I sat down, I had a good long talk, took about 5 minutes. Leslie, don't do that. And I truly work on this literally every day. And I think it makes a difference. So this is important because when each and every one of us becomes a better healthcare consumer, whether it's by finding a primary care physician, collecting medical records, collecting the family history, having an emergency card, learning how to get to the no mistake zone, or having a positive attitude about the future, when one of us has that, particularly for you women who are so central, who are committed to this, which is why you're here, there's a family that's going to get better health care. And once we hit a tipping point in which we get a number of families, enough families, particularly in a community like this, that are getting better health care, we're finally going to get the healthcare system we all deserve. And I think it's the only way. So thank you all. You've been patient. You've been wonderful. I'm so grateful.